The philosophy of Back in Motion is a process. It includes clearly defining and really understanding the goals and needs of a patient. Some of the more common problems that we treat involve the neck, the cervical spine, and these include cervical disc herniation, cervical stenosis, and patients that have already had a cervical procedure, including a fusion, including a discectomy, and now are having a secondary problem which requires additional attention. I'm going to go over a couple examples of patients that we've treated and show how we go through the process of defining goals, understanding options, understanding objectives, and develop a strategy how to meet these goals and objectives to come up with a plan that will best suit the patient. This is a 20-year-old elite level collegiate athlete, dancer, jazz, modern dance, who came to us from Texas, who has a 2-level disc herniation with a clear goal of wanting to get back to doing what she loves, which is dance. She failed every possible course of non-surgical treatment, and at this point in time was looking for a surgical option for her problem. And what we came up with was a procedure that included traditional and newer procedures that allow her to fix the problem, get the pressure off her spinal cord, do a procedure that's safe and effectively can maintain as much native structure as possible and maintain as much motion as possible. What we did was, at the C5-6 level, which is a level that included stenosis, a decompression, took the pressure off the spinal cord, and did a fusion. And at the C6-7 level, which included only a soft disc, which was not dangerous but was painful, we put an artificial joint in. And what that did is, rather than doing a 2-level fusion, which would stiffen the spine and substantially stress the adjacent levels, we did a procedure that maintains as much mobility as possible, so the adjacent levels would not have as much stress, allow her to maintain the type of activity that she does, and also preserve the longevity of the procedure.
Thankfully, the surgery has allowed me to continue dancing, and I feel healthier than I ever have before. I'm no longer in pain. I have full rotation in my neck. I'm not limited by anything. 3 years on my birthday, actually, that I had the surgery, and I honestly feel fantastic. It's like nothing's ever happened. I'm so grateful to Dr. Cantor for his care and for his continuous follow-ups with me, and he's just an overall really incredible person, an incredible surgeon.
I'm proud to say that she's about to start dancing professionally and enjoying a lifestyle that's unrestricted.